A very good evening. My name is Khatija binti Abdullah. I'm currently pursuing my Bachelor of Nursing Science with honors, and today's presentation will be on psychology and sociology writing assignment. Moving on to the next slide, which is the content of my presentation today, consisting of introduction, brain function and behavior, genetics and behavior, hormones and behavior, psychological factors, sociological influences. Holistic nursing assessment, teamwork in nursing, tailored interventions, education and advocacy, discussion from scenarios from 1 to 3, conclusion, and finally ending with the saying "the apple does not fall far from the tree" shows how behavior is shaped by both inherited traits and our environment. In nursing, it is important to understand how the brain, genetics, and the hormones influence behavior. These biological factors help explain conditions like depression, anxiety, schizophrenia, and more. When nurses understand these influences, they can give better care, especially to patients with mental or behavioral health challenges. This presentation explores how biological, psychological, and sociological factors all work together to shape behavior. As nurses, we must go beyond physical symptoms. We need to use therapeutic communication, respect cultural backgrounds, and create care plans based on the whole person and not just their illness. The goal is to help nurses think critically, understand the full picture, and give care that supports the mind, body, and environment of every patient. The brain's role in behavior, cognition, and psychiatric disorders plays roles as well. The brain is a central organ that regulates behavior, cognitive functions, and emotional responses. When there are structural abnormalities or imbalances in neurotransmitters, psychiatric disorders may develop. For example, schizophrenia has been linked to the dysregulation of dopamine pathways, leading to symptoms like hallucination and delusion. Contrast. Major depressive disorder MDD is often associated with a deficiency in serotonin, contributing to persistent low mood and fatigue. Nurses caring for patients with these conditions must understand the neurobiological basis to tailor their intervention. A person with MDD may benefit from pharmacological treatment targeting serotonin reuptake along with cognitive behavioral therapy or CBT to address negative thought and patterns, as mentioned by Lin and Bassett 2019 in their writing. Like neurodegenerative disorders and brain injury, Alzheimer's and Parkinson's diseases involve brain degeneration, causing memory and motor issues. Brain injuries, especially to the prefrontal cortex, affect behavior and impulse control. Nurses must provide behavioral strategies and cognitive support tailored to each condition. Moving on to nursing intervention and support strategies, effective nursing includes medication, therapy, and structured care environments. Emotional support, cognitive therapies, and caregiver education enhance recovery and quality of life for patients with psychiatric or neurological condition, as mentioned by Lin and Bassett, 2009. On this slide, I'll talk about hormonal influence on stress, social bonding, and mood. Hormones like cortisol, oxytocin, and estrogen significantly affect behavior. High cortisol from chronic stress can cause anxiety, depression, and memory issue, as mentioned by Russell and Lightman 2019. Oxytocin supports emotional bonding. Deficiencies may lead to social withdrawal, especially in autism. Hornberg et al. 2020. In this slide, I'll talk about hormonal fluctuations and behavioral intervention. Fluctuation in sex hormones affect mood. Postpartum depression stems from sudden drop in estrogen and progesterone. Elevated testosterone may increase aggression and impulsivity. Nurses must assess symptoms and apply behavioral therapy, counseling, or medications to regulate hormones and support emotional stability, as mentioned by Hornberg et al. 2020. On this slide, I'll talk about psychological influences on behavior. Psychological factors like thoughts, emotions, and mental processes shape behavior and coping. Cognitive distortions, such as catastrophizing, can worsen depression and anxiety. Nurses can apply CBT techniques to challenge negative thoughts and promote healthier, more balanced thinking pattern, as mentioned by Anderson et al. 2019. Emotional regulation, personality, and coping plays important role as well. Emotional regulation is crucial for mental well-being. Disorders like BPD and GAD may cause emotional dysregulation and impulsivity. Nurses can teach mindfulness and relaxation. Understanding personality traits help tailor care while encouraging health coping mechanism build resilience, as mentioned by Gaina Kakis et al. 2009. Not forgetting sociological influences on behavior, social and environment factors like cultures, family, and socioeconomic status significantly impact mental health. These influences may buffer or intensify psychological conditions. Nurses must consider these broader influences in assessment and care planning to ensure more effective and individualized intervention. Social support and socioeconomic status plays role as well. Social support improves mental health outcomes while its absence can worsen conditions. Nurses should assess support networks and refer patients to resources or groups. Low socioeconomic status may cause stress and mental health issues. Nurses must address financial and access related barrier as mentioned by Hu et al. 2009. Moving on to next slide, I'll talk about culture, family dynamics, and stigma. Cultural norms influence how patients perceive and express mental health concerns. Family dynamics also affect recovery with supportive families aiding progress. Nurses must provide culturally sensitive care and reduce stigma by fostering open communication and educating patients and families, as mentioned by Kalati et al. 2008. Integrating psychological and sociological influences. Nurses play a vital role in addressing the full spectrum of patient health. By integrating psychological and sociological influences into care, nurses can actually ensure a more holistic, patient centered approach that supports both emotional well being and social stability alongside physical health needs. Next, holistic assessment in nursing. A thorough assessment should include psychological factors like mental health symptoms, post trauma, and coping strategies, as well as sociological elements such as culture, social support, and socioeconomic status. These insights help nurses identify underlying causes affecting recovery. Stain et al. 2020. In this slide, I'll talk about how collaborative and multidisciplinary care can help. Effective nursing care often requires collaboration with psychologists, social workers, and occupational therapists. Working as a team ensures patients receive emotional, social, and practical support. Nurses coordinate care to overcome barriers and support long term recovery through shared planning and action. On this slide, I'll talk about tailoring interventions to individual needs. Nurses should customize interventions using psychological approaches like CBT or mindfulness and sociological strategies like family therapy or community referrals. Addressing both areas together promotes better outcomes. For example, teens facing bullying may benefit from both counseling and social support programs. Bierman 2019. For education and advocacy in nursing practice, nurses educate patients and families on how stress, isolation, and financial issues impact health. They also advocate for access to therapy, support groups, and aid services. This ensures patients are empowered with knowledge and connected to the resources they need. Henda et al. 2000. Moving on to scenarios, I'll start with scenario one, which is showing about depression and social isolation. A 45-year-old unemployed male presents with depression, social withdrawal, and low self worth. Interventions include CBT to challenge negative thoughts, connection to peer support, referral for financial aid, and promotion of exercise and healthy routines. As for outcome, mood and self esteem improve with structured support. For scenario two, which shows adolescent anxiety and academic pressure, a 17-year-old female experiences panic attacks due to academic pressure. Evidence based care includes mindfulness, CBT, school counseling, and parental psychoeducation to reduce unrealistic expectations. As for outcome, anxiety decreases, coping improves, and the student experiences better well being and academic performance with family. Moving on to scenario 3, which shows about schizophrenia and medication non adherence. A 30-year-old homeless male with schizophrenia struggles with medication adherence. Intervention include motivational interviewing, long acting injectables, ACT team involvement, and housing assistance. Outcomes stable housing, continuous care, and consistent medication lead to fewer relapses and improve quality of life. For conclusion, the biopsychosocial approach in mental health nursing. Biological, psychological, and sociological factors all shape mental health. Nurses must use critical thinking and evidence based strategies to address each area. A holistic biopsychosocial approach improves assessment, intervention, and outcomes, supporting recovery and well being across diverse patient needs and conditions. Herein, I have included the references that I have included in my writing to assist with my writing and my presentation as well. References again that I use to assist myself to get information on my writing. Well, thank you for your attention. I hope this presentation has provided valuable insights into psychological and sociological topic that we face in nursing and how we can address them in our daily practice.